All right. Hi, my name is Jenny Maynard. I am a F&P student at the University of Memphis. I will be doing my head and toe assessment today on my patient Kyle. Today is August 26, 2023. I will be doing a scan of the room first. I'm going to scan all 4 walls. The floor behind my patient, this wall, I have my supplies, my Snellen chart, the floor around me, and the ceiling. Now I will start my head to toe assessment. Can you state your name and date of birth?
Kyle Maynard, 6/16/95.
Okay, today I will be doing a head to toe assessment on your head, face, neck, anterior and posterior chest, abdomen, and lower and upper extremities. I will do a skin assessment throughout, and I will be assessing and inspecting the skin. I'll be inspecting the skin color, temperature, moisture, texture, any lesions, bruising, scarring, edema, turgor, and nevi. I will first start with the head. I will inspect for size, position, midline position, and symmetry. I will then palpate the head and scalp. I'm inspecting for hair distribution, hair color, hair texture. I am going to palpate for any lesions, any depressions, any masses, tenderness, and infestations. I am then going to palpate the temporal arteries for tenderness. I'm going to look at the inspect the lymph nodes and palpate them. I'm going to palpate the preauricular, postauricular, occipital, tonsilary, submental, submandibular, anterior cervical, posterior cervical, and supraclavicular. I will then move on and palpate the TMJ. I will palpate for TMJ, get the patient to open and close his mouth. I'm palpating for subluxation, tenderness, and crepitus. I'm going to assess cranial nerve number 5, which is the trigeminal nerve. I'm going to palpate the master muscle and get the patient to clench his jaw. That's assessing the motor function of that nerve. I'm going to assess the sensory function by getting the patient to close his eyes. Let me know what body part I touch.
Forehead, right cheek, left cheek, nose, chin.
All right, I'm going to assess cranial nerve number 7, which is the facial nerve. I'm going to get the patient to do a few movements for me. Smile, frown, raise your eyebrows, pucker your cheeks, puff out your lips, or the cheeks, yes. All right, so then we will inspect the ear. We're inspecting for position and shape. I am palpating the outer ear on both sides. We're palpating the pinna and the tragus for tenderness and masses. I'm going to inspect with my otoscope the tympanic membrane and auditory canal. We're looking for that the auditory canal is patent and that the tympanic membrane is pearly gray. I'm looking on both sides for that. Then what we do, we will test the vestibulocochlear nerve, which is cranial nerve number 8, by doing a series of hearing tests. I am first going to do the whisper test. I'm going to get you to cover this ear up for me. I'm going to say
1, 2, 3.
And other side.
1, 2, 3.
All right, then we will do the Weber test, which is assessing for lateralization. I'm going to get my tuning fork, put it in the middle of the patient's head, and let me know if you can hear it on both sides equally.
Yes.
All right, I will do the Renee test. I'm going to ignite my tuning fork, and let me know if I'm going to put it on the mastoid process if you hear that and
yes.
Still hear it. Okay, I'm going to do that on the other side.
Yes.
And now?
Yes.
Okay. All right. So we were testing the to make sure that air conduction is greater than bone conduction. So then we will move along to the eyes. I will be inspecting the brows, lashes, and palpebral fissures. I'm going to inspect the conjunctiva and sclera. I'm looking at the color, inspecting the color and any lesions or discharge. I am going to assess cranial nerve number 2, which is the optic nerve. We are going to test gross visual acuity. I'm going to get the patient to turn here and look at the Snellen chart. I'm going to get you to read the last 2 lines for me.
LTFPH.
Okay. And then cover one eye and do the same.
LTFPH.
And the other?
LTFPH.
All right, that's intact. I'm going to test, get you to look forward, and I'm going to test peripheral and central vision. I'm going to get you to cover this eye. Let me know when you can see my hands.
I can see it.
All right, another eye.
I can see it.
All right, look forward.
I can see it.
All right, and let me know when you see my fingers.
No.
All right, we peripheral and central vision is intact. I will then assess cranial nerve number 3, which is the ocular motor nerve. I'm going to test, do a vision test, testing the direct consensual pupillary response to light. I'm going to grab my light source, and I'm going to make sure that the pupils contract with light on each side. There we go. I'm going to now test the accommodation and convergence. Follow my pen light in and out, and they accommodate. We are then going to assess cranial nerve number 3, 4, and 6, which is ocular motor, trochanter, and abducens. I am going. That is testing for conjugate gaze in the extraocular movements. I'm going to get the patient to follow my pen light source in all visual fields, all 6 of them. All right, that's great. Then we're going to assess for red light reflex and the internal eye structures. All right, I'm going to put my hand on his shoulder. We're going to look for the red light reflex. Once we find it, we will move in, looking for any nicks. And I'm going to do the same in this eye. I'm going to find the red light reflex. There we go, and move in, looking for any nicks in the internal eye structures. All right. Then we will move to the nose. I'm going to assess that the nose is midline and straight. I'm then going to assess cranial nerve number 1, which is olfactory. Assess that the sense of smell is intact. Smell this and let me know what you smell.
Apple.
All right, great job. And then we are going to assess the nasal passaging. Close this. Breathe in, and the other, and breathe in. Okay, that's great. And then I will palpate the sinuses, the frontal and maxillary, and then we will assess the. I'm going to get my my light source, and we are going to assess the mouth. I'm going to be assessing the lips, the teeth, open your mouth, the gums, the buccal mucosa, the palate, tongue, under the tongue, the floor of the mouth, salivary ducts. I'm going to posterior pharynx and tonsils. This patient doesn't have any tonsils, but if he did, I would grade them at this time. I will now get the patient to say ah. I will be testing cranial nerve number 9 and 10, which is the glossoopharyngeal and the vagus. That is, I'm going to make sure that the tongue and the soft palate rise symmetrically with phonation. I'm going to test cranial nerve number 12 by getting the patient to stick his tongue out. All right, I'm going to make sure that the tongue is midline and moves without fasciculations. That is cranial nerve number 12, which is the hypoglossal. We will then move along to the throat. I will inspect the patient's throat, palpating for the trachea, making sure it's midline. I will get you turned this way. I'm going to come behind the patient and palpate you can hyperextend. I'm going to palpate for the thyroid gland on each side. Swallow for me. All right, and then I'm going to palpate the carotid artery one at a time, carotid pulsations. All right, and then we will assess. You can turn your back to the patient. We are going to assess the posterior chest for any signs of respiratory distress, which is use of accessory muscles, tripod positioning, nasal flaring, retractions, tachypnea, and cyanosis. We will inspect for any obvious deformities and that is symmetrical. After inspection, I'm going to palpate. I'm going to palpate for chest expansion by getting the patient to breathe in. All right, and then we're going to do tactical firmitus, palpate for tactical firmitus. When, say 99.
99, 99, 99, 99.
All right, and then we're going to percuss in the intercostal spaces. Then we are going to auscultate. I'm going to auscultate over, I'm going to be in my diaphragm, auscultate over the scapula, alternating from side to side. Deep breath. In between the intercostal spaces, down the lung fields, the lung bases. On the left side, I will have 2 fields, and on the right side, I will have 3. There is a middle lobe. Then I will do a few other tests. I'm going to do agnophony. Say E when you feel my stethoscope touch your posterior chest.
E, 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 E.
Bronchophony. Say 99 when you hear my when you feel my stethoscope touch your back.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
All right, now I'm gonna do whisper pertorically. Whisper 1, 2, 3.
1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1,
All right. I'm going to get you to turn around for me. We are then going to inspect the anterior chest. We're going to inspect for any respiratory distress, any obvious deformities, and any that is symmetric. We're going to palpate for chest expansion, getting the patient to breathe in for me. All right, and palpate for tactical firmitus, 99.
99, 99, 99.
All right, then I'm going to auscultate the anterior lung fields. Take a deep breath in. All right, and then we will auscultate the cardiac points of auscultation with our diaphragm and bell. Aortic is the second intercostal space on the left side. Pulmonic is the second intercostal space on the right side. Erb's point is the third intercostal space on the left side. On the right, on the left side. Tricuspid is the fourth intercostal space on that left side, and then the mitral is the fifth intercostal space at the mid-clavicular line. We will do that on the bell, turning that and listening for any murmurs. Aortic, pulmonic, Erb's, tricuspid, and mitral. At this time, I will palpate and identify the PMI. I will then auscultate for a full minute the apical pulse to identify the rate and rhythm. For this video, we will not do a full minute. I'm just going to say 76 beats per minute regular rhythm. After that, we will get the patient to lie down. His head will be at a 30 to 45 degree angle. I'm going to assess for jugular, JVD, any jugular pulsations. All right, I'm going to inspect the chest for any lifts or heaves. All right, and then I will palpate in the cardiac points for any thrills. All right, and then we will move along and inspect the abdomen. I will then auscultate again with the patient laying down. I will auscultate with my diaphragm and bell. My diaphragm, aortic, pulmonic, herbs, tricuspid, and mitral. I'm going to turn my bell, check for murmurs, aortic, pulmonic, herbs, tricuspid, and mitral. And then I will move along and assess the abdomen. I'm inspecting for any contours and any, make sure it's symmetric. I will then, with my bell and my stethoscope, I'm going to auscultate the arteries for any bruise. Aortic, renal, iliac, femoral. All right, and then I will auscultate for bowel sounds in all 4 quadrants. Right lower, right upper, left upper. All right, and then I will percuss in all 4 quadrants. I should be hearing tympani. And then we will palpate for any masses or tenderness. I'm going to palpate the liver, which is the upper border right here. You should feel the left lower border of the liver as normal. And I'm going to palpate for the spleen on the right side. I'm going to put my hand under the patient and palpate right here under the rib cage. You should not feel the spleen. That is normal in a patient. I'll will then get the patient to sit up and turn around and have your back face the camera. We will palpate for CVA tenderness. Right there where the kidneys are. So you can turn around for me. We will do a series of tests, testing for musculoskeletal. So right now I will inspect and assess the hands, wrist, elbow, and shoulders. I'm going to inspect the joints for any redness, swelling, any deformities, any crepitus. Looking for symmetry in both. All right, I'm going to assess the radial pulse and assess capillary refill in the fingers. Assess radial pulse. All right, and then now we will do a series of tests. We'll check range of motion in your fingers, flexion, extension, hyper extension, adduction, or abduction and adduction, thumb opposition. Your wrists, we're going to do flexion, extension, hyperextension, ulnar deviation, radial deviation, rotation. The elbow, flexion, extension, hyperextension. All right, we're going to do the shoulders, flexion, extension, hyperextension, abduction, adduction, internal fixation, external rotation, not fixation, and then we're going to do circumduction. All right, and then we are going to do the strengths. I'm going to get you to squeeze my hand. All right, there we go. You got a 5 out of 5 in your hand strengths, and then we will do your elbow. I'm going to get you to flex your elbow, flex and extend your elbow with a resistance. We're going to be testing the tricep and bicep strengths. So push down against me, and push up, push down. Okay, push up against me, and down. All right, we will be doing the same thing. We'll do assess the shoulder girdle. I'm going to get you to abduct and adduct against resistance, and out with both, and in with both. All right, and then I'm going to assess cranial nerve number 11, which is accessory nerve, the shrug against me with resistance. Okay, and then we will be doing the, I will just be assessing doing some assess cerebral coordination movements, fast acting movement, fast moving. We're going to do finger opposition and touch each thumb with your finger. There we go. And then I will do the flip-flop test. And then we will do your finger to finger touch. Touch your nose and then touch my finger. And then with the other hand. All right, then we will do stereogenosis and graphesthesia. With stereogenosis, I will place an item in the patient's hand, close your eyes and tell me what it is.
Pen.
All right, other hand.
Pen.
All right, and then we will do graphesthesia. Let me know what I write in your hand.
3.
What letter did I write?
N.
Okay, good job. And then we will do, we will assess the color and temperature, warmth, and skin integrity of the lower and upper extremities, looking for any edema or anything. Then we will assess light touch function. I'm going to let me know when if it's light or sharp.
Soft.
Soft or sharp?
Soft.
All right, in both lower extremities. And then we will do a vibration sensation test. I'm going to ignite my tuning fork and put it on the wrist, on the ulnar prominence. Let me know if you feel that.
Yes.
Okay.
Yes.
Okay. Medial myalis. You
Yes.
feel that? And feel
Yes.
that? All right. Then we will do the deep tendon reflexes. Brachial radialis. And the bicep. Just limp. Okay. And the tricep. I'm going to this side. The brachial radialis. And the bicep and the tricep and limp. Okay. Patellar. And patellar. All right. Then we do the Achilles. We'll do the Bazinskis. It'll be ticklish. All right. And then we will assess the lower extremity joints. I'm going to assess the joints in the hips, knees, ankles, and toes. I will assess these joints for any redness, swelling, any nodules, deformities, and then any crepitus, and then make sure they're symmetric. I'm going to assess the capillary refill in the toes. I'm going to assess the dorsio-pediis pulse and the posterior tibial pulse. All right, and then we will do a series of tests to test range of motion in your toes. Do with your toes what I do with my fingers. Flexion, extension, hypo, and then abduction and adduction. All right, and then we will do your ankles. You're going to do plantar flexion, or dorsiflexion, plantar flexion, eversion, inversion and eversion, and then rotation. All right, and then we will test the strengths. I'm going to get you to put plantar, dorsiflex and plantar against resistance, and then push up, and the other one, and down. All right, and then we will test your knees. I'm going to flex and extend the strength of your knee. Flex and extend, back, and extend, and back. All right, then I'm going to assess your hip strength. Abduct against me, and then adduct against me. All right, great job. And then we will stand up. We will do some strengths of the, I'm going to get you to come back. Yeah, we're going to have to, so we can see you. All right, we're going to do the hips. For the hips, we're going to do flexion, extension, hyperextension, abduct, circumduction, internal rotation, external rotation. All right, then we'll do flexion with the other foot, extension, hyperextension, adduction, abduction, and then adduction, circumduction, internal rotation, external rotation. All right, and then we will do the elbow, not elbow, the knee, flexion, extension, hyperextension, flexion, extension, hyperextension, and then we will do the hip, or we did the hips and the knee. So now we will do the spine. I get you to turn around. We are going to, turn this way and then bend over for me. I'm going to palpate and assess the spine. I'm going to be inspecting for expected curvature, the alignment of it, and the alignment and tenderness. And I will be assessing for scoliosis. Now we will do the range of motion of the spine. So we're gonna go flexion, extension, hyperextension, lateral flexion, and rotation. Then we're gonna do the cervical spine, flexion, extension, hyperextension, and rotation, and lateral flexion. All right, and then we're gonna do the Romberg to assess balance, and close your eyes. All right, and then we're going to watch your gait, go forward and back, and do tandem gait, which is heel to toe. All right, and then hop on one foot. All right, great job. This concludes our assessment.